Have you ever been told your symptoms are all in your head? Or given a vague label like chronic fatigue or fibromyalgia without any real answers? In this episode, we dive into how people are stuck with lifelong painkillers, the chronic pandemic we live in, and the rise of viral infections, and what precision medicine does different. Hello, Dr. T.
Hi.
How are you?
Great to see you. Thank you.
Great to see you too. Today I have with me Dr. Tamer. He's the founder and the chief medical officer of Precision Health Group and the heart and the mind and the vision behind Precision Health Group. Thank you for joining, Dr. Tamer.
Thank you very much.
So we're going to start our episode by giving a general question about something you mention very often, the wastebasket diagnosis. What do you mean by that?
Very good start. Because, this term, wastebasket diagnosis or trash can diagnosis, is kind of an informal term that is used by many healthcare professionals and doctors certainly for conditions that are not very well explained and also can be used as a scapegoat, as a way for you to blame that condition for a patient may be suffering from. So wastebasket diagnosis is a very broad term that is used, and we can throw in a lot of cases and a lot of symptoms and signs and just put it under that definition.
Okay. And doctor, why do you think today many people are being labeled with chronic conditions and we are focusing more on treating symptoms, and sometimes they tell them their conditions are untreatable and they have to live with them for the rest of their lives?
Another very good question. So that ties into the first question, in which you've asked about the wastebasket diagnosis. So let's take a very specific example where many people, you'll notice now, especially post-COVID, are being diagnosed with conditions like fibromyalgia. So fibromyalgia is technically means a pain in the muscles and the fibrous tissues of the body. So multiple symptoms, including fatigue, including joint pain, muscle pain, soreness, sometimes coupled with a lot of also mental fatigue and brain fog. And it's all put together under that big diagnosis called fibromyalgia. The criteria for diagnosing fibromyalgia is even so broad and so flexible that it can be a diagnosis of convenience, which means the doctor or the healthcare professional, when not being able to explain why these symptoms are appearing, they put that into this category of fibromyalgia
as a diagnosis of exclusion.
And that's why it's a wastebasket diagnosis in my and many other doctors' definition. Now, these chronic conditions that are untreatable, as you mentioned, mostly are very complex conditions that have a lot of factors, causes at play. So it's not only one issue that is causing this. For example, migraine is one condition. Another condition could be what people label as SIBO, small intestine bacterial overgrowth. And also metabolic syndrome is a condition now that is so widespread, particularly in cities and in fast-paced lives of the modern human race, with a combination of everything from hypertension to overweight and obesity to poor control of blood sugar. That is a very complex condition. Each one of those symptoms or signs have multiple roots, and they're so intricate. And it is very difficult to treat such conditions using a single line of treatment or a single pill. This is very important. An example is like a tree. You've got one big trunk of the tree. That is what is above the surface. But when you look below the soil, you'll get very complex, intricate, and deep network of roots. And if you don't understand how these roots interact with the soil and with each other and reflect on the surface through the health of that tree, which leads, from a trunk to the different branches, and then the fruit comes out. People want to treat that fruit, so they notice the fruit is sick, so they're quickly trying to use different methods to treat that symptom of a sick throat without looking at the whole system. And that is the reason why a lot of these conditions are deemed or basically pronounced as untreatable with only symptomatic treatment to help with the conditions that are also labeled as chronic for life.
And doctor, speaking of this, how do you think the examination nowadays is different from 20 or 50 years ago? What we are doing differently now?
Well, doctor's time is usually extremely scarce. And we just mentioned, for example, we mentioned there's a trunk and complex network of roots. And if you want to really investigate and try to understand the reason why you're seeing what you're seeing in the clinic, you need time. And time is absolutely very limited. I mean, some studies I've seen basically estimate the time spent by a doctor with a patient around 10 to 15 minutes on average. I'm not saying all doctors spend that much time. And in some countries, particularly in developing world countries, this goes down to 5 to 7 minutes. Now, if you go to meet your doctor wherever it is, and he has to comply with so much paperwork and so much electronic technologies where he needs to put in your data and your details into the system and connect it to and request your lab online and so on and so forth, and he's only got 10 to 15 minutes with you. Say 7 minutes go out in that, and then 4 or 5 minutes talking to you. How much more time do you get, this doctor gets to actually examine the patient? So this limitation of time, which is kind of caused by the squeezing of time by the additional forms, tools, bureaucracy basically that needs to go behind the scene, as well as the heavy dependence on technology, leads to very limited time to investigate and understand the case before the doctor. For example, we all know about the doctor-patient relationship. This is a relationship that is built over a long period of time. The foundation of that relationship is trust and compassion. So the doctor needs to feel compassion towards the patient and understand their problems and willing to listen, and also heavily rely on their sense, because medicine is an art. It is really the art of medicine that is being practiced, and it's all about being sharp, being able to notice things as the patient walks right through the clinic. Maybe somebody's coming because of an elderly patient is coming to your clinic with knee pain. The minute they walk in, you notice some signs of depression already on that older patient. If you neglect this, how are you going to try to motivate them to go and take a walk every day? They're already depressed. They're fighting with very low levels of motivation and engagement neurotransmitters in their brain. So that comes through sharp observation, and that is even before the patient starts to talk. As they start to talk, the doctor needs to be fully there and fully engaged with them, listening carefully, not being concerned about the bureaucracy or registration on the computer. I think many of us have gone to today's clinics where the doctor is sitting behind the desk and just typing, and very little time spent with the patient. There's doctors work in an institution. The institution want them to follow these protocols. And then lastly, is the art of medicine and examination. So when you want to really take a careful history and observe the patient, and then you start examining the patient, you really need to have a lot of intuition, a lot of presence. I call it presence. The doctor needs to be present and feeling how the patient basically is, and following their intuition and practicing the art of medicine. And then they'll find clues that help guide their journey towards diagnosis. So 30, 40 years ago, I mean, when I was in med school, we spent a lot of time on examining and listening and sitting with the patient. And we had very senior, experienced artists, I call them, practice the art of medicine, that really come to us and said, did you look at the patient's eyes? And what about the color of the skin? Did you notice the loss, the little bit of loss of hair on the outer 1/3 of the eyebrow, for example, which, oh, okay, Did you see the thickness of the skin? And all of this requires being present, being alert, being conscious, being compassionate and focused. In today's world, it's very difficult in the practice of medicine to show all of this. And hence the diagnosis process turned from being artistic to mechanistic, and through an exclusion, and with the age of AI now, we're going to see even this become more and more of an issue, really, because the artists are going to disappear and the mechanics are going to take over that. That's not to say that there are fantastic, compassionate, very good doctors that are out there. Lots of colleagues are. I'm amazed by how much passion they put into their profession, and it shows. Their clients and their patients, their clients feel that passion, and they continue to stay committed, connected to them, and also quite pleased with the results they get.
Doctor, we know like functional medicine nowadays is trending. We know that it came after the conventional medicine in order to help people, especially with chronic diseases management, because we all know like conventional medicine fails somehow. But I also know that you have many reservations towards functional medicine. Would you explain that more and why these reservations?
Yes, that's actually a very good question to tie into the examination 30
Yeah.
years ago. So 30 years ago, we spent more time. In essence, I believe the call for doctors to practice functional medicine is really a call for doctors to go back to the art of medicine, spending, on average, a functional medicine doctor will spend anywhere between 40 to 60 minutes, sometimes 90 minutes with their patients. So just a good doctor spending that long of a period of time with their client or patient will be able to get so many more clues. Now, functional medicine also connects those clues to a holistic understanding of the function of organs, of the function of systems. Let's say, the cardiovascular system has a function, and it is a very high level understanding of that function that is supposed to be underlying the practice of functional medicine, or what is called functional medicine. Honest with you, my reservations stem from a number of angles. First of all is that I feel that it's kind of, functional medicine as a term is being used more from a marketing perspective, honestly, which is not befitting for the novelty of the job of being a physician or a doctor. In the 70s, in North America, particularly in the US, there were associations of holistic doctors. And there was also environmental medicine, which is very big. And holistic doctors are doctors that look at the whole system rather than just looking at one part of it. If you go back 100 years, even, those were naturopath doctors. The naturopathic doctors need to look at systems, really. So that's why a lot of the functional medicine practitioners come from the naturopathic medicine background, because they have to understand, they have a more holistic understanding of how the body works and different systems and the body interact with one another. So the roots of today's quote-unquote marketing functional medicine comes from a very noble and well-founded establishment of naturopathic medicine, holistic medicine, later integrative medicine, and today's functional medicine comes from that. However, you mentioned reservations. The nature of monetizing of the medical profession, which means the current monetizing of the medical profession, which means how much money will the doctor make at the end of the day, or the institution make, means that if the doctor is going to spend an hour and a half with the patient, they have to find a way to make a higher return to compensate for the time spent, especially if they're very good and hence expensive doctors. As I mentioned, the compassion element is going out of the formula, replaced with a lot of materialism. To do that, it means they need to make up for that time through a lot of billing and a lot of requests from the patient, which is a bit of a gray area, because indeed, if you want to investigate all these routes, you need to ask for a lot of tests sometimes, and a lot of labs, and spend more time on examining the patient and so on and so forth. But sometimes there's a lot of tests that I see today that are not relevant. Let's take an example of gut problems. I mean, the gut is highly innervated. People use in their common terms words like well, he doesn't have the gut for it. What does that mean? It means your gut responds quickly to your emotions, right? And we live in a world plagued with stress and anxiety, and as a result, that means a lot of people are going to have more gut problems. So you've got a cliche in gut, which is let's check the gut microbiome through gut testing or testing of the stools, and let's give a lot of probiotics. So gut microbiome testing is not cheap. We know that. But I believe before you do that, there's a lot of good practice of holistic integrative medicine that needs to be done ahead of going to test the gut microbiome. And I have a lot of reservations on using that as kind of like a holy reference, the gut microbiome, for solving the problem of the patient. Because really we know that the microbiome community, and maybe we can talk about this in a different time, gut microbiome differs highly at the different places or different spaces within the GIT, the gastrointestinal tract. And so what you test in gut microbiome, you're really testing the stools. And right, so the stools coming at the very end of the colon, different community of gut live there from the one that is in the small intestine that is responsible for absorption and sometimes partial digestion of food. Even the ones in the small intestine, there are different communities living at the beginning of the gut and then the end of the gut, the small intestine. And hence, what you get in the stool sample is a good, let's say, guide. It's not really the actual kind of holy reference to the gut community that lives inside a client or a patient's gut. And hence, a trained holistic integrative, or I use the term precision medicine doctor, will look at that test differently. He'll look at it in a specific way, and we have a specific way of teaching practitioners how to look at this from a pathogenic standpoint to a beneficial bacteria to an acid-producing bacteria and other microorganisms in the gut. So that's an example of how the kind of the marketing angle of what is called today basically functional medicine has taken over the way to investigate this process thoroughly and precisely. Other examples are quite a lot, but I'm going to move to this other part of your question where you said you prefer to replace precision medicine. Yes, I do prefer to use the term precision medicine, and precision medicine is an evolution of personalized medicine, right? So personalized medicine means it's targeting you, targeting the client, and it is for you, and it should work for you, really, and it's more like bespoke, befitting for you. Now, precision medicine as a term also has its own problems because when you put that term forward to the medical community, the first thing that comes to mind is oncology, because of the fact that precision medicine refers to mostly the application of understanding the genotype of different types of cancers and choosing the targeted therapy or drug for them. So it is a very precise approach to treating cancer, very specific and very personalized. And indeed, that is called precision, a practice of precision medicine, but it is only precision oncology. Precision medicine is much wider and greater and bigger than that. It includes basically, in my definition, using a precise approach to diagnosis and a precise approach to therapy and treatment. So a precise approach to diagnosis means using a multimodal diagnostic techniques, including investigations in your clinic, in-clinic testing and examination, laboratory testing on various levels, from genetics to epigenetics to sometimes metabolomics also and others, and then using a precise approach for therapy as well, where you use the least amount of pharmaceuticals to achieve the highest results, and you combine that with a lot of complementary therapies for the body and the different systems of the body to heal. And so precision medicine to me is more precise. And of course, when you're more precise, you save a lot of time and you save a lot of effort and trial and errors.
And money, basically.
And money, of course. Because if you can solve someone's guts problem with a very simple saliva test, which we do and we teach the practitioners to do, you don't need to spend a lot of money on the gut microbiome if you've got a problem starting in the mouth. You can tell very quickly how it works.
Yeah, and I think this is very important because we see a lot in the functional medicine practitioners, or the functional medicine approach is not accessible for everyone.
No.
It's more for specific people of the society who can afford doing the functional testing. And that's why we like to promote the idea that it can be for everyone if we know what to use. And this brings me to my second question, Doctor. You developed the diamond system of care and precision health using your approach to precision medicine. Can you tell us more about this system of care and how it is different from anything available?
Let me start by giving you the background of developing that system. The background is that, okay, if you are a very good healthcare professional, or if we're dealing with a very good doctor, he's got his ways, or she's got her ways of finding out the problem and treating it. But now I want this doctor accessible to 100 other patients. So it's very difficult because their time is limited. They may be limited by location as well. So we need to find a way to create a system to teach the majority of doctors and healthcare professionals to follow a thinking process. It's a process in approaching and tackling complex issues or normal issues, but we follow a specific, just like when we in med school and in early medical practice, when you're going to take a history, you ask about family history, then you get a complaint. There's a way to follow to structure a proper history report, and then you come up with differential diagnosis, and then probable diagnosis, further testing, and then diagnosis, and then treatment. So that is a system for building up a thorough, comprehensive history for a patient. How can we apply this to precision medicine? It's so complex. So I started by thinking about the layers we need to incorporate. It wasn't at the beginning basically a diamond shape. And I thought about those layers coming into like a pyramid. So you've got a base layer, then a smaller layer in the middle, then there is the apex of the pyramid. And then I thought about this pyramid is what you may see. For example, you may see the patient's diet. That's the apex. So you know what to eat, right? But we know that diet corresponds directly, healthy diet corresponds directly to overall health and wellness. So that's another apex of another pyramid. So diet, good, nutritious, balanced diet leads to wellness and health and longevity. So that's another apex. What about sleep? So we know that if people sleep very well and they get enough deep sleep, not just hours of sleep, then there is this is the unmatched solution for all immune system problems. Immune system only gets reset after certain hours of sleep that include quality deep sleep. So now we've got sleep. We can ask the patient how they sleep, and we can investigate if their sleep is healthy. And from there, we'll understand the immune system. So now you see we're building now kind of a pyramid, one pyramid and another pyramid that corresponds to it. So when I put those together in my mind as a visual image, they turned into a diamond. And then I thought in my mind, let me animate this a little bit, a bit visual. So if we flip it over, so if the patient tells me about their immune problems, I'm going to have to investigate their sleep.
Their sleep, yeah.
If they tell me about their sleep, I can investigate the immune. So now it looks like two pyramids that fit one another to create this lovely diamond shape. And the layers of one pyramid correspond with the layers of the other pyramid. So now we've put them in a very simple way of describing it is to look at someone's diet, sleep, stress, digestion and absorption, elimination, which removes toxins, right? And then we can look at someone's genetics, which can influence all of the above. And then finally, the overall, basically, some or all of these elements, some or all, will reflect some or all of the symptoms and signs they have. And then these diamonds, if we use that same approach to approach diagnosis, so we're going to create what I call an investigational gem or an investigational diamond. Then we approach it for healing, then we create a healing diamond or a healing gem. For the manifest gem, which is what you see or the client sees or the patient sees in their lives, that becomes the manifest one. The hidden one is what you don't know. People may be waking up with a sign or symptom, but they don't understand this is related to their blood sugar because that's part of the hidden gem. So we need to look at it there. It's a little bit difficult to visualize, but if you think about those two parts in the structure, we've built it into the manifest gem, the hidden gem, the investigational, and the healing. And then you apply any condition to that system, and you'll be able to fill in these layers and have a structured approach to tackling or managing such case or dealing with such condition with better outcome of the results at the end of the day, making sure you're not missing out on any of these important layers to deal with the complexity of the condition or the case we're dealing with.
And does this system of care apply to everyone?
Yes, it applies to everyone. I mean, just think about these layers that I mentioned to you right now. It applies to you, me, and everybody else who's maybe listening today. Are you having a healthy, balanced, nutritious, because you could be having healthy, balanced, but not nutritious diet, right? Nutritious diet means it's full of these trace elements and then things that are required. Are you supplementing it with the right supplements? And then are you sleeping well? Are you stressed? And if you have stress, are you managing the stress well? And then are you digesting and absorbing properly? Are you getting rid of the toxins properly? And are you using the right approach that befits your genetics? Because everybody's genetics are a little bit different, and that kind of commands how you interact with the environment and the world around you at large. So it can fit anybody.
Okay. And doctor, through my years of working with you, I always hear you speaking about how we live in a world infected by viruses. So can you explain more to the viewers? How is that?
Yes, absolutely. I use many terms around the age. I call it the age of viral infection. We live in such an age where, I mean, the whole world experienced this during COVID, right? So COVID is just one of these viruses, right? But I mean, the truth is, because the world was so focused on it, 100 years after the Spanish influenza, right? The world was hit by this calamity and this disaster of COVID. Everybody started to turn their attention and focus towards viruses. And then you must have read it on the news and read it. Now people don't read newspapers, so you must have read it online or heard it somewhere in the news where they say, oh, a new strain has been discovered, and a new strain has been discovered here or there. And then the Brazilian strain and the UK strain, those viruses are mutating at an ever rapid rate, basically. That was COVID, right? So imagine how many other thousands upon thousands of these viruses that live around us. Viruses are very unique creatures because they're alive only when they're inside your cells or inside the host cells. And then they have a unique, trait, which is to be able to go to the control center of the cell. So imagine the cell is a huge virus, very small, so it's like man landing on the moon. That's a virus going in. But then they go to the command center, they go to the nucleus, and they immediately start switching on and off certain proteins and expressions within the blueprint of the cell itself, that is the DNA of the cell, and they fiddle with it. And it's so funny because a lot of the studies around cancer and oncology are related directly to viral infections. So of course, there's some very common examples like the human papilloma virus, HPV, and its correlation to cervical cancer. That's a very good example, actually, now that I say it, because we notice that some studies show you that, like, for example, females who smoke have a higher incidence of cervical cancer. Females with infection of certain viruses, particularly HPV, some strains of those viruses of the HPV have a much higher risk for cervical cancer. So now, what does smoke and a virus have to do with each other? Well, smoking creates a microenvironment. That is the toxicity we talked about in the diamond system of care. Infection, on the other hand, by the virus, there is now a creature that hijacks the cells and plays with the DNA, fiddles with it. And they may flip the wrong switch and the cell turns into a cancerous cell. The question is, why is it now that it's such a world of viruses compared to before? The main reason behind this, viruses have been on this planet for depending on what studies you read, millions and hundreds of millions, maybe, of years. Those viruses are very ancient creatures. But why are they so prominent right now? Part of it is the diagnosis, the ability for us to sequence a lot of these creatures and understand them. Before, we didn't have these tools, so now we're much more aware of their presence in our lives, in our environments. But the reason why we're getting a lot of virus-related pathologies, diseases and illnesses, is mainly, in my opinion, related to the fact that in today's world there's a lot of mixing of different human beings from different environments, ethnicities, together. And as those creatures mix together, each human being has got a world of an immune system and a microbiome, microorganisms that live in their bodies, at peace or at war with their immune system. When you mix these ethnicities quite a lot in small and sometimes closed spaces, like shopping malls, like schools, the host immune system interact with each other in a very funny way sometimes. And the viruses that lived with a certain host quickly mutate to try to adapt because they want to survive. They can infect another host and cause disease and quickly run through like fire. Talking 100 now, let's say 200 years ago, travel was not as fast. So people did not change locales with different environment, from a very cold to very hot weather, very humid to a very dry place overnight. They couldn't do that. They had to basically adapt throughout a journey that sometimes through boats or caravans of travel, it would take days, sometimes months, right? So the body was adapting throughout this period. And even when they landed in new lands, there was always this quarantine, which comes from the Latin word that means 40 days. When somebody lands, they examine them. If they show any symptoms, they put them aside for 40 days to ensure that they are not bringing with them anything that could cause a bigger problem. So there was a lot of quarantines, slower modes of travel, less mixing of races, ethnicities, and hosts from different parts of the world. Combine all these factors together with a very intelligent and a smart creature like virus, they'll mutate very quickly and they'll find their ways to rule over the host bodies. So now we see these massive, basically, outbreaks of different viruses in different places in the world. And only the ones that are causing serious pathologies are being thoroughly studied for their mutations, new strains, and so on. But only God knows how many others that pass unnoticed and unknown to us that could be causing far bigger damage that is unseen as well. So the age of virus. People use now social media to say something went viral.
Right.
So we're living in viral social media. We're living in a viral, environment that is ruled by these.
So we live in them instead of living in them.
Certainly, it's a good point. Actually, we don't live in viruses, but we live. A human being may have certainly more microorganisms in their body than their own cells. Some studies estimate this to be 1.3 to 1. So let's say you have 100 cells in your body. No, it's not 100, it's billions, right? But let's say 100 cells, you've got 130 microorganisms. So the truth is there's a constant tidal waves that are coming and going and a constant clash between your body and those organisms that you live inside. Not just viruses. They've got bacteria, viruses, other creatures like fungi, archaeobacteria, and others.
And doctor, speaking of social media, we know now we can't live without it. People are even attached to their phones most of the time. It's becoming more of an escape for everyone. But we also hear you talking a lot about digital toxicity. How can we prevent it? How can we detoxify ourselves from the digital world, and how does it actually affect our health?
Well, I think this is the most difficult question, really,
Yeah.
because as we speak now, I think that many people are maybe watching this dialogue over social media or probably through other tools that we're warning against. So I have my own methods for trying to keep my sanity, and I'm not saying personally that I succeed all the time, but I try very hard, and it's very hard because you live in a world that is super interconnected, super fast, and if you're not part of it, you're left out, and that's very very sad in a way. But but on a level of what this does to the human brain and what this does to the human emotions, because you've got the brain, which is an organ you can actually, and then above the brain there's people's emotions, right? And these emotions are based on people's perception,
Yeah.
right? So perception, or what you may perceive the stimuli as, how you perceive it and believe in it in a certain way or the other, it turns into emotions, and then the brain responds to these emotions. Like fear has a signature of a neurotransmitter response. Like anxiety has a signature as well. Now, in modern day medicine, we know that there are a number of neurotransmitters. These are molecules, biomolecules that are secreted, that are reacting to how people feel in general. And we understand those molecules to, in my opinion, they denote or they show you how the real condition of the person and or the client or the individual. The human, let's go back again hundreds of years ago, human beings' lives was much slower, much more boring, and much more present. So think about this. If someone is living in a forest or someone is living even in a town 200 years ago, they will get the mail once a month. So they won't be getting this stimulation except once a month. Let's just look at mail as an example. So in expectation for receiving the mail, let's say the mail comes every Sunday, the first Sunday of the month, the postman comes and drops in. So maybe that person on Friday, the Friday before, is expecting that mail and excited about it, translated into the brain with the certain neurotransmitters like dopamine and others are being secreted in excitement, expectation for receiving that signal, right? And so when it comes, then there is other forms of neurotransmitters that are secreted as they read it and they feel some good news coming from some traveling family member or a friend, or sometimes bad news as well. But this happens once a month. Now this happens 200 times a day for us. So what happens is that this shot of these neurotransmitters is we're constantly being bombarded with these stimulations, tick tick tick, all the time. Two things: we lose sense, so we don't feel anymore. That's why you have unprecedented levels of depression, lack of motivation. Motivational speakers and speeches are very popular, and I don't know about 300 years ago if there were any motivational speakers. There weren't. But to me, when I look at this, I think about it from a different angle. Like motivational speakers, they must be needed for unmotivated people, probably, that need to listen to this motivational speech. Why? Because they lack motivation. One study that I read one day was that teenagers in one country, the rate of teenagers subscribing from getting a driver's license at the age of 18 dropped sharply. I don't know, 30-40%. Meaning a teenager doesn't want to drive anymore, and which was in my teenage days, it was like a dream. When can I get my driver's license and take the car and drive and enjoy? There's no enjoyment and there's no engagement. That is because of that constant level of stimulation. Now, anything in overdose becomes toxic. And I believe the ongoing, constant bombardment of stimuli between notifications through any tool that is out there, notifications and scrolling, because every time you remember you scroll, it's like a slot machine, it's like a gamble. When you scroll, there's something new that will come. There is a specific chemistry in your brain that expects that something new. If you can do that too much, you become addicted, number one, like people getting addicted to gambling. Number two, then the brain becomes less sensitive, if at all sensitive, to things that should excite the brain to start with. That is now an intoxicated human being, intoxicated with the digital avalanche and the digital tsunami that took him or her over. And we see the response. We see the body responding in different ways to such intoxication. Sleep, diet, high sugar diet, high carbs. This is all related to the fact that there is an overstimulation, there is a complete meltdown of the neurotransmitter balance system in the human body. And females suffer even more because they're more sensitive. Their endocrinal system is super sensitive compared to males. And we see a lot of cases from disturbed menstrual cycle to amenorrhea to loss of fertility to polycystic ovarian disease, PCOS, and others. And on the psychiatric level, we see a lot of depression and a lot of anxiety, major anxiety disorder. And then that cascades down to impacting the gut, impacting the behavior, the sleep pattern. This, if we go back to that example I gave you of the tree, this goes back, if you search deep, you will find a big chunk of the root network is connected to this intoxication with digital stimuli. That is digital toxicity. You asked one question, so I don't lose that question. You said, so how do we prevent or protect from it? Well, there's a number of things. I mean, obviously, this is it's not $1 million question. It's probably $1 trillion question because everybody's trying to find a way to solve this. And a balanced life where the stimulation is low. First of all, if you're intoxicated, you need a recovery period, right? So there needs to be what I call digital fasting for a certain period of time to remove such toxins from the body, because digital fasting works, and we know that it works with people. You've got to fast for a long period of time to regain, and it is exactly like withdrawal symptoms of a lot of forms of addiction. So that's one way to treat this. The other thing is the kind of balanced diet or supplements that people take. There are lots of these supplements that can help relax the muscular and neuromuscular junction and muscles and brain. Then the good quality of sleep. And just a quick advice is that people with phones should have a switch on and off time for their phones. I'm not saying switch off the phone completely. I'm just saying if someone needs to reach you after 7 p.m., they can give you a call. Otherwise, you're going to be checking whatever messaging system you're using, and sometimes it's not one, it's multiple messaging systems, only after 8 a.m. First night you try to practice that, you'll feel so scared and you'll feel so worried. Second night it's going to be a little bit better. By the 10th night, it's going to become a habit, and that is a very healthy habit that will help the quality of sleep, reduction of anxiety, and as well as the more balanced, tranquil living, which will reflect on the other systems in your body.
So, doctor, you expect like the digital toxicity might be a pandemic?
Oh yes, no doubt. Digital toxicity now, you just need to check how many billions. I mean, I'm not going to name specific platforms, but choose any of these famous platforms in your mind and go and ask your AI now and say, how many members are there? You'll find that some of those have twice the number of the population of India or the population of China, or combined India and China are part of that network with an unreal world. Because, you know, when someone comments on something you type or a photo that you put out there, that's not you, and that's not them as well. That person, both of you are not the real person. So there's no actual, what I call quantum state being exchanged between the two. When we're sitting now and talking, you're in a specific state, I'm in a specific state, and that creates that quantum exchange, which leads to the experience and then leads to the benefit at the end, or the outcome. The digital experience that we all go through every day is an amputated experience. And just to give you a funny example of many people booking their holidays nowadays based on a very good marketing of a specific destination. You see these fantastic coconut trees, beautiful golden sandy beaches, and you think, I'm going to go to country X or Y or Z, and then you book, you pay, and you think it's phenomenal. And the minute you land and start walking on the beach, nobody told you, and nothing in the picture or the video spoke about the humidity or the insects. Right? People landed like, this is not what I expected. I thought this is going to be
And they spend
heaven.
it most on their phones.
That's another story, but that may be that may be a distraction from the humidity, so maybe good.
So it's like we're, instead of taking something to detach, to take care of ourselves and even our health, we're actually harming it more. And our phones are playing a big role.
Not just the phones, yeah, phones and technology
technology
in general, but also I like the fact that you mentioned taking care of ourselves, and I like the fact that you mentioned the S in the selves, which means it's a plural. I take it differently. I think what people mean when they say taking care of ourselves is everybody taking care of of themselves. I mean of our collective self, because and that goes back to this holistic approach, or the diamond system of care, is if you've got the right, I mean, modernity as such today, and of course the digital toxicity and digital life we live in, are always directing people to be on their own, lonely and alone. So much so that eventually they're unable to actually really have a good time with others. So when you say selves, I mean as a group. So do not underestimate the therapy people get from being together around a healthy, loving, compassionate, and caring environment. And this is kind of slipping. I travel quite a bit, and when I'm in the airport, I sit at a restaurant and I constantly watch families, and there you go, mom and dad and the children. Everybody is on their device. And the food is there, and they could be eating but not paying attention. There's no connection at all. And the irony is that people say, "Are you connected?" And they say, "Yes, I've got connection. I'm online, but online but off life." Really, that's what it is.
That's a nice term. So, Doctor, we discussed a lot of things that I think are really interesting for people to listen to, especially that people now are more into wellness. They have some kind of lack of trust in our healthcare system, especially after COVID, and they're going towards more understanding the importance of food as a medicine, and understanding that they need to be listened to, and all of that. What is your parting advice for our listeners?
I think the beauty about the diamond system that I described earlier is that it can be the advice. Please look at your food and make sure that food is balanced. So every day think, did I have enough greens? Did I have a salad? Did my son or daughter have enough? Am I having food that has less preservatives? Just do green, away from preservatives. Preservative is any food that you keep on the shelf for 3 days and it doesn't go bad. That means this food has got something seriously wrong with it, because fermentation is part of the natural process. So that's food. Then sleep. And on the sleep, my parting advice would be blue light. If you're listening to something before you go to bed, make sure you switch off the screen so it's not emitting any blue light, because blue light has been shown through many studies to disrupt the melatonin cycle, which is one of those master hormones that regulate everything else in your body. So you may be sleeping, but you're not sleeping. So that's sleep. In terms of stress, I mean, whatever method everybody has for themselves to reflect. Some people may pray, some people may meditate, but you need that time taken as a break. Just like you take a break to eat, you need to take a break to meditate pray, have a spiritual system to help you combat stress. So think spirit versus stress. The S to fight the S, basically. With a spiritual system, you can overcome stress. So now we've tackled this. Just advise on diet, stress, and sleep. And those three from our diamond system of care are super sufficient for you to take care of the others. And you'll see amazing results through this. Now, obviously, I want to say something on that note is a lot of people are turning to, you mentioned something, people are, after COVID, are more aware of their health and wellness, and they're seeking and searching basically alternative methods. Because we mentioned at the beginning of our dialogue today that the healthcare system is becoming more bureaucratic, more technology-based, less connection, less compassion. So life and life is a wave in its essence, which means it's like water. If there's a rock, bureaucracy, failure of healthcare, it's just going to find a way around it. And that's what people are doing by seeking advice and understanding on social media and reading. And now with AI, it's amazing the amount of information available for a normal consumer. A normal client can get super advice, a lot of information from there. I must correct myself, not advice, information, right? But you need to also find yourself the right coach for all of that. So it's very important that you have an advice from someone who understands your case, your needs, your condition. Because I see thousands of these videos, for example, on the importance of magnesium for your muscle relaxation, the importance of selenium for memory, and they're all true, and they're posted by sometimes a lot of respected colleagues around the world. But is selenium going to work for you? Did you check the different genetic elements that make your body responsive to selenium or not? That's why me and my research team have developed tests and testing to, I think it's probably, I haven't seen anything else like that, a world first test to check for different supplements and how your body responds to them. Are you going to benefit from the B12 you take? Are you going to benefit from the vitamin D that you take, or selenium or magnesium or manganese or zinc? And which ones do you need more? Which ones do you benefit from more, and which one you benefit from less, and which ones that you don't even benefit from? You're spending years and years on such supplementation that doesn't work. So that comes from that good advice from an informed, caring informer. So it's good to collect information on the internet and through reading and asking your AI or different tools that are out there. But you really need a coach. You need a guide. You need someone to be at least overlooking and controlling that process and helping you go through that journey from being good to being better, and then from better to being really the best.
All right. Thank you so much,
Thank you
Doctor.
very much. I really enjoyed it.
That was really an eye-opener session, and I hope everyone enjoys it and benefits.
Thank you very much, and thanks to your audience and to everybody in your team.
Thank you.
Pleasure. Thanks.